Welcome. This is Dr. Bob Cuyler. I'm the Chief Clinical Officer of Freespira, and I'm pleased to be working with you today to share an overview of what Freespira is, the kind of patients we treat, why we do what we do, and how to access the system. Freespira is an FDA-cleared treatment for panic attacks, panic disorder, and PTSD, and it's the only currently available treatment that addresses some key physiological factors that are associated with these conditions that other typical therapies don't address. So one commonality among these conditions is a feature of the human physiology called carbon dioxide hypersensitivity that's associated with all kinds of subclinical respiratory irregularities. This hypersensitivity is manifested in laboratory settings by an interesting diagnostic called a CO2 challenge test. If you give people with these conditions a single inhalation of carbon dioxide-enriched air, you precipitate panic symptoms on the spot. And interestingly, in the case of people with a background of PTSD, it not only precipitates panic symptoms for most of them, but some experience post-traumatic flashbacks and dissociation, which are kind of the cardinal symptoms of PTSD. Our company developed this breakthrough treatment that's aimed at normalizing carbon dioxide levels in the system and helping people stabilize their respiratory rate. And people who use this regularly find that there are significant reductions in their symptoms, high remission rates, and also real changes in terms of healthcare utilization. So here you see the Freespira system. The Freespira system is, again, a FDA-cleared digital therapeutic, and the system consists of a respiratory sensor, and attached to that respiratory sensor is a simple nasal cannula that the patient wears during this 17-minute practice that we recommend that they do twice daily. The system is meant to be done twice daily for 28 days, and the ask for the patient is relatively simple. They are going to hear a rising and falling audio tone, and their job is to synchronize their breathing with this audio tone, to breathe in as the tone is rising, to breathe out as the tone is falling. And as they do that, they will see a graph of their exhaled CO2 levels, and their job is to change their inhalation patterns so that they move their CO2 levels into the normal level. The system also has a real robust data science capacity. Every time the patient uses the system, their data is uploaded to a company secure server that measures whether the patient has done their 2 daily sessions, whether they have completed those sessions, whether they're hitting their respiratory targets, and also by virtue of some simple symptom questionnaires, whether their condition is improving. Wrapped around this system is also a telehealth coaching component in which company personnel train the person how to use the system, train them about the desired breathing style, and coach them through the 28-day period about how to optimize their breathing, support them through the practice, and how to get optimal results. What you see here is a representation of what the patient is looking at when they do the Freespira intervention. On the left-hand side, this is an actual first session graph from a patient with moderately severe to severe panic disorder. On the bottom, we see a green zone which shows this very, very spiky graph, and let's translate that. What that means is that this patient is breathing in a very fast and irregular fashion. Up above in the blue zone, we see the normal level of exhaled CO2 levels represented by a horizontal line. And what we can see is that the patient is typically breathing significantly below what our normal exhaled CO2 levels would be. And these are kind of the prototypical kind of conditions for somebody who suffers from recurrent panic attacks. In the middle, we see the same patient 7 days later. Now their breathing has stabilized. We see a smoother green line, which means that they are pacing themselves to the rising and falling audio tones. So that tremendous spikiness we saw a minute ago has really diminished. And we see that their CO2 measurements are moving towards the normal zone. On the right-hand side, we see the patient, very same patient in their final session, and now at 6 respirations per minute, which is half of the respiratory rate they were originally breathing at, They are breathing in a very smooth and stable fashion, and their exhaled CO2 level is now solidly in the normal zone, not only when they are doing the paced breathing, but in the final 5 minutes, the far side of this graph, they are breathing essentially on their own without the audio pacing, because the purpose is really to help people develop a self-management skill, to really reinforce a breathing style that they can employ going forward. At the end of 28 days, the patient will send the system back, but at that point they have learned how to breathe in a stable, healthy fashion, and they have learned it well enough that they are able to kind of recreate it on their own just as a natural practice, but also if they're feeling stressed or the onset of any kind of panic symptoms. But the point of this is really not to produce pretty smooth graphs. The point of this is really to make an impact on not only symptoms, but quality of life. And what we've found in repeated clinical trials done with this intervention, that individuals who will use this therapeutic regularly for 28 days have very, very significant reductions in the symptoms that brought them into treatment, and a real change also in terms of quality of life. I'm going to walk you briefly through what we know about the clinical published evidence for use of this intervention. There have been several different studies that have been published that have enrolled people with significant histories. On the average, the patients in these 3 clinical trials have been diagnosed with panic disorder for greater than 10 years. They have had multiple other treatments, but at the point at which they enrolled, they have moderately severe to severe panic. On the left-hand side, we see a bar graph that shows these clinical populations with a panic disorder severity scale that's in the moderately severe to severe range. The first of these studies was done, really the foundational study, by a group out of Stanford using laboratory-grade equipment. Our company developed a practice-ready system for use of this protocol developed at Stanford. And the second 2 bars are research programs that were available for anxiety clinic populations. In the middle, we see these same populations 28 days later or immediately post-treatment, and their panic disorder severity scales have gone down markedly from scores of about 15 to about 5. And a score of about 5 is really considered to be at the remission level, i.e. the person no longer really qualifies for a formal diagnosis of panic disorder. Research projects followed these patients a full year post-treatment. This was really what was initially striking to me when I started looking at the scientific published data, that patients who underwent this 28-day protocol a full year later had really maintained the clinical benefit, and in a couple of the studies, their clinical benefit had really improved more at the end of 12 months. And the best takeaway we have of that is that once these panic symptoms have resolved, that people no longer engage in the avoidance behaviors that they have used to stay away from the situations that might precipitate panic symptoms. Those would be something like taking public transportation, public speaking, getting on a crowded elevator. So once those panic symptoms are under robust control, people then are able to really kind of resume a much more full life. I've certainly had clients who've been successfully treated who have gone from unable to fly on an airplane to be able to fly internationally within several months. PTSD was the next logical condition to look at after panic, and let me tell you a little bit about why. One is that there's really significant clinical overlap between the conditions. About 75% of people who have PTSD also have recurrent panic symptoms. I mentioned that carbon dioxide sensitivity test earlier in this talk, and people with PTSD are also highly reactive to that CO2 challenge test in provoking panic symptoms. We also know that there's what's called a bidirectional relationship between panic and PTSD. People who have panic symptoms are highly likely to develop PTSD if they are exposed to traumatic situations, and people with PTSD are highly likely to develop panic symptoms as part of their symptom complex. This particular study was done at the Palo Alto VA, and interestingly, it was open to both civilians and veterans. The patients used exactly the same protocol as in the panic trials, but measures of PTSD were really the outcomes that were assessed by the researchers. In this particular trial, 6 months post-treatment, almost 90% hit one measure of clinical success, and that was a 6-point reduction in the CAPS-5. The CAPS-5 is really considered to be the gold standard measure of PTSD improvement. And over 80% had at least a 13-point symptom reduction. And this is really a higher bar for really being able to conclude that people have had significant clinical benefit from use of the intervention. And 6 months later, a full 50% of the enrolled patients were considered to be in remission. That is, they no longer met criteria for the diagnosis of PTSD. Treatment adherence was also quite strong. What this 77% treatment adherence statistic means is that the patients who were enrolled did 77% of the recommended 56 sessions over the course of their 28-day. And as in the other trials, the patients had no access to the Freespira system once the 28 days was finished, so that we see the clinical benefit without actually access to the formal treatment protocol. So what we're seeing is that the learned behavior and the symptom improvement is persisting even though the patient is not actively doing the intervention that they were exposed to in the clinical trial. The company has also recently applied for what's called a COVID waiver for the treatment of adolescents. Prior to this COVID waiver, we had been confined to offering this under our FDA clearance for patients age 18 and above. And by looking at our statistics, both from a research project and our commercial use for off-label adolescents, we found that the adherence rates for adolescents was every bit as good as those that we see in our adult population. And we also see very, very striking reductions in the panic disorder severity scale. In commercial use, about 52% decline in the panic disorder characteristic PDSS scale was true for adolescents, 54% for adults. So we can see that there's really comparable benefit for adolescent and adult populations. As I mentioned, we're FDA cleared for the treatment of panic disorder, panic attacks, and symptoms of panic. So if you think about it in this way, the patient that really fits this profile either has a formal diagnosis of PTSD. We'll also mention PTSD, of course, is associated way beyond what most of us think of as a combat-related condition. There are many civilians who develop PTSD. These may be victims of violence, sexual assault, natural disaster. We also know that during the pandemic that rates of panic and PTSD are significantly rising because of exposure, frontline personnel exposed to individuals who were desperately ill, dying. They're exhausted in providing their care. These are the kinds of things that create the vulnerability for the development of PTSD. Panic attacks may also occur with other conditions, even though that might be the formal diagnosis. For example, people with social anxiety disorder, if they are in a large public gathering, they may experience panic symptoms. People with agoraphobia who confine themselves to their home because they have panic symptoms when they leave their home. There are people who have phobias, who have panic reactions when they're exposed to a situation such as heights or spiders or snakes and such. And there are many people with depression who also have recurrent panic symptoms. Depression alone is not an authorized condition, but in the presence of panic symptoms, we really become an available treatment as well. As I mentioned before, we are also now available for individuals ages 13 to 17 because we found that these individuals are as likely to benefit as adults, and we aren't seeing any change in terms of risk profiles or side effects that would differ in any significant way from the transient discomfort that we have seen in adult populations. We don't use Freespira during pregnancy. The system has not been tested during pregnancy, so we don't know from a safety standpoint that it's safe to use during pregnancy. We also know that in the third trimester, mom's respiratory characteristics are changing in a way that would really make this treatment not appropriate for somebody during pregnancy. So that's a screening question in the authorization process. There's also a syndrome called Pickwick syndrome or hypoventilation syndrome of obesity that we also inquire about during the screening process. And this is a condition that involves somebody who is very significantly overweight, suffers from sleep apnea, has abnormally low pulse oxygenation and very high CO2 levels, and so we're not appropriate for someone with this condition. We also screen for somebody who may have COPD or other respiratory illness that would associate lung damage and a respiratory style that would really not be appropriate for use of this intervention. We also don't recommend use for this intervention during either an acute medical or psychiatric crisis. The individual has to be prepared to be able to use this intervention twice daily in the comfort of their home. I'll also mention that this is not meant to interrupt panic attacks in process. It's really meant to be daily practice that will prevent the onset of panic or PTSD symptoms as we go. We also are asking for clearance by a personal physician if the person is known to have a history of COVID infection. We know that lingering respiratory problems are common for post-COVID, and we want to make sure that we've got a good medical clearance, that lung recovery has been sufficient, so we ask for that medical clearance by a personal physician. We also just want to mention we would advise someone who is using heavy intake of stimulants such as caffeine, heavy smoking, stimulant use, concurrent use of cannabis. These are not reasons not to use Freespira, but they also may potentially lessen the impact, so we'll do some educational program with an individual as appropriate. I want to talk a little bit about how we introduce Freespira to our individuals. One is we really do like to emphasize that the intervention is FDA cleared, and as part of that, we've had to present both efficacy data and safety data, and we can comfortably say with multiple published clinical trials that over 80% of users have significantly reduced panic symptoms or PTSD symptoms after using Freespira for 28 days. The side effect profile is really very, very light. There's no need to change existing treatment either with medication or psychotherapy during that point. We are available completely remotely now, and our clinical specialists can train the individual and provide follow-ups over secure video and phone. It can be provided entirely in your home, and it's a non-medication treatment. For some people, that's really quite important, just from a personal preference standpoint, or because those individuals may have had side effect problems with prior medication treatment. And we're going to teach you a new way of breathing that's going to develop a self-management skill that you will learn how to do, that you can master, and then use long after the formal treatment episode is done. Really kind of teach you not only to breathe in a different way even when you're not thinking about it, but to be able to have that aha moment. I'm finding myself breathing in a really irregular way that tends to happen when panic symptoms are beginning, and this is something that I can do instead to really change the trajectory. What I find with my clients is that people really kind of learn to spot when their breathing is getting dysregulated. They learn what they're feeling when they're feeling very stressed, and they can shift into an overlearned breathing style that really helps them settle those stressors down and nip those exacerbation of symptoms in the bud. With that, I want to thank you for your time and attention, and we are available if you have any questions to reach out to us to help you learn more about Freespira, about how to refer or authorize your patients, and offering this innovative treatment to everybody that is in your system that we think we can help. And thank you so much for your time today.